They're all similar.
First stop on our journey is hearing a bit from Kirsty and I on the challenges we're facing in our healthcare systems today. The second stop is an amazing journey mapping opportunity that you see on your table there. And third, we're going to hear from a very special guest who's leading innovation through the state.
All right, we're rolling today. Thank you for being patient with us. Through that entire adventure, we hope you walk away with 3 things today. The first, an understanding that people are struggling to navigate the silos in our current systems of care. And second, we must begin to work together to create more people-first systems that will address many of these current challenges, because people-first systems prioritize people's needs and experiences. And third, journey mapping is a new innovative tool that we can use to help create more people-first systems that promote health equity. Can I get a show of hands, people in the room or virtually, who is already familiar with journey mapping? Okay, awesome. Okay, how about on the other side? Who's maybe not as familiar with journey mapping? Okay, this is best case scenario. So for those of you who are not familiar, we're excited to get to share this new tool with you. For those who are, you have the opportunity to share that perspective and experience with others in the room. So thank you all for being here today.
I think she's going to do a really good
We
job.
now want to begin this adventure by diving into some of the current challenges that we see across our systems of care here in Colorado. We know many people, including you, are working hard to support the health and well-being of Coloradans across our state. And yet, we also know that it's still often difficult to get the care and services that we're looking for. Our public health, our healthcare, and our social service systems are often driven by policies and decisions that were created in silos and are often based on past practices and ways of knowing. These silos often lead to complicated enrollment and eligibility requirements, right? Multiple phone calls to get insurance information, several portages that make scheduling appointments a headache, new and changing community resources, wait times, and wait lists. I could go on and you could probably add to this list yourself, right? We've heard time and time again from our community members through stories and statements like this. There is no clear process. It's disjointed. It's not comprehensive. Sure, my care coordinators are amazing people, but it's still far more stressful and complicated than it needs to be. You just grow tired of being tired. When you have the right support, it's not hard to get better.
Who in this room has experienced this before? Please raise your hand. There are a lot of hands. Those on Zoom, please raise your hand. And if you didn't experience yourself, who knows someone who has a loved one, a family member, a neighbor?
Many of us, or many people we know, have experienced these challenges, and that is why it's so important that we begin to work together to create more people-first systems. Because like I mentioned earlier, people-first systems address many of these current challenges to create more positive and equitable experiences for people accessing and delivering care.
So to move towards people-first systems, we must step out of our silos, agree to come together, and most importantly, agree to keep people at the center of every decision that we make. So you're all wondering, how do we do this? So as we mentioned, we're going on a journey mapping adventure today, and journey maps are modern tools that help us put people's experiences at the center of care delivery. And it really helps us do what we do best: plan and design and deliver to our people. And journey maps are used in many federal agencies and many state agencies. And I've put a few logos up here of agencies that I've personally worked in who are using journey maps. An example of how this comes to life. So I was a White House fellow and I worked on Biden's Cancer Moonshot 1.0. And we were looking at equitable clinical trials and patient experience and how we might connect patients to breakthrough therapies more quickly. And through using journey maps, we were able to cut timelines down from 3 days to 3 hours. And it's looking at journey maps, visual, holistic view of a complicated process that really unites diverse subject matter experts together to solve complex problems faster. So when you're going into your breakout today, some of you may see this on your desk and the table in front of you, you're going to be looking at a journey map template. And this template has a couple different categories. And it's always based on a person. So each person will have a different person story to listen to. And then you'll think through the actions, emotions, and pain points of that person's experience. And of course, this all happens over time. And this really brings to life our planning, our policy making, because not often are we thinking about the dimension of time. So before, during, and after. And in this case, we're looking at COVID vaccines, either delivering or receiving. And we just want you all to know that these journey maps can be used in any number of care scenarios. It's not limited to the vaccine.
Nina, this is beginning to be intriguing, but what if everyone with us today don't feel like they have all the answers quite yet?
It's a great question, and that's completely okay. So we are creating a safe space. Journey maps are about learning and growing and exploring. And we don't have all the answers, and part of it is figuring out those answers together. And as part of this activity, we're all inviting you to take the rubber band that's in front of you on your table. So you should see a rubber band in front of you. And go ahead and put that on your wrist. Be careful. Well, it's a reminder to bring your flexible mindset to this activity. So anytime we try something new, a new way of working, a new way of thinking, we want to be flexible. We don't want to stretch and break the rubber band, nor do we want to leave it behind. So bring it with you on your adventure. We also are here for you. So Kirsty and I will be facilitating a breakout alongside our amazing facilitators in the back of the room, Ashley and Nina Bastian. So say hello. And then Nicole, who is on Zoom with you all who are virtual, will be your guide. So you can always ask questions.
All right. Who knew you were going to have to go on a workshop journey today? I think we're ready for this, though. We all believe in you. And so I'm going to go ahead and give you a little bit more background. So perhaps you feel a little bit more prepared to try this journey out. And again, for those of you who already have experience with journey mapping, this is an opportunity for you to kind of shed that knowledge and support for your upcoming team members in your group. Okay, so the purpose of this activity is to ground yourselves in those current challenges that we visited when we first kicked off this presentation, right? The current challenges that people are experiencing across their systems of care. Remember to bring your flexible mindset. In just a moment, the guides in this room will organize everyone into 4 groups, 1 in each corner of the room. Once you're with your group, listen to the story that your guide will read out loud to you. This is a story about a fictional person, but it's meant to represent a real person here in Colorado. Based on this story, think about the person's actions that they took, the emotions they might have felt, the pain points or unmet needs they might have experienced. Think on that together, discuss it with your group, and at these corner tables, there are each a journey map. You'll have the opportunity to put your thoughts down on sticky notes and place them along the person's journey. And again, just like Nina said, if you have any questions, even right now or at any point in your journey, your guides will be with you to help you out, whether you're in the room here or joining us virtually. You will have 20 minutes to work together through this exercise, and then we will come back together as a large group to reflect. How did that experience go for you? What new insights are you taking away? And maybe perhaps what's one new action you want to move forward with after going through this experience? I also want to iterate once again what Nina had shared. You're going to listen to one person's story, one person's example of going through a care experience, but keep in mind that journey mapping is really meant to be a tool for any point of care or service. So just keep that in mind as you're working with your groups, because you might not have all the answers. And that is the point here, right? It's all about imagining yourself in someone else's shoes and what that might be like. And as your guides will show you along the way, part of that process is also coming up with questions, right? I don't have this piece of information. This would be really helpful moving forward, right? So just know that as you're going through the journey map exercise. Okay, I'm seeing some smiles on people's faces, and I'm also seeing a little bit of uncertainty. And I think the best way to try this out is just to get started. So I am going to invite our guides. Please go ahead and help us organize the room into our 4 groups. You'll have 20 minutes to work together, but we'll give you a 5-minute warning before we come all back so you can wrap up your conversation.
Hi, virtual attendees. I hope you all can hear me okay. Can I get a thumbs up or an emoji or an icon from someone just to make sure you all can hear me? Great,
Hey, Nicole,
thanks,
we can hear you.
Lynn. Thanks, Peter. Appreciate it. Welcome, everyone, to our virtual breakout
Wonderful.
room.
Our Spanish-speaking community
Oh.
members and interpreters will join Ashley's group today, Nina's group today. Okay, that's totally fine. We just
Hold on,
swapped. So
everyone.
Nina, will you raise your hand?
I'm just going to mute the room. I'll just press mute there, and we should be able to work out okay. Thanks for sticking with us through the tech issues, but I think this should go a little bit more smoothly since we have control over the Zoom room here. I am so excited to have you here as we talk over the next 20 minutes about our journey map, and we're going to walk through it here via a Zoom whiteboard, and my colleague Emily is going to be helping take notes for us. I am a senior program manager at Colorado Health Institute. I have been at CHI for over 4 years, and I work on our public health portfolio. So you've probably seen me if you've worked on those portfolios with myself. And Emily has been working at CHI for about a year or so, right? Yeah, about a year. We are so excited to meet all of you. Since we have a big group today, if you could put your name and your organization, your area of work, just about 1 or 2 sentences in the chat, that would be wonderful. So we get to meet everyone here. So we'll follow the chat while you say hi. Hi, everyone. Thanks for joining. We have folks from Caring for Colorado, University of Denver, CDHS, the Ute Tribe, Center for Rural Outreach, Clinica Family Health. Hi, Laura from Douglas County. It's nice to see you all. Hi, Jennifer, Dr. Cog, great to have you here. We have Calfo on the line as well. Various health system practitioners, Dawn Health. Great, this is actually be wonderful. It's really nice to hear the variety of systems and the variety of people we have in the room with us today. And that is what we are going to be talking about. So I just wanted to remind everyone as we go into our discussion today to have the flexible mindset, think about that rubber band. I know that you don't have that physically with you, but think about that as we go into today's discussion. So we're going to start by listening to a story. Our story is Elaine Kim. I'm going to read you all her story, and we're going to use that to do our journey map in just a second. So forgive me while I read this on a piece of paper for all of you. Okay. Elaine is a 52-year-old straight cisgender Asian American woman who has 2 children in high school. Elaine has been married for 27 years. She is a care coordinator at a local family resource center. Elaine supports her clients in navigating care and resources through hospitals, clinics, human service agencies, and community-based organizations. She finds the job rewarding, but it's also difficult because she has personally experienced some of the challenges that her clients face, like housing instability and poor mental health. Elaine is struggling to stay up to date on where her clients can get access to COVID vaccines. Some of them have private insurance, others have Health First Colorado, and others have no insurance at all. She knows there are walk-in appointments available at a local clinic, but many of her clients can't get off work before 5 p.m. Elaine is frustrated at the effort it takes to keep her resource list current. A couple of facts for you all. Did you know that 7.1% of people in Colorado experienced housing instability in the past year? This is from the CHAZ 2023 data. And 26.2% of people in Colorado experienced poor mental health in the last year. That's also from our 2023 CHAS data. Now take this information about Elaine and reflect on her journey to figure out how to successfully refer her clients to get COVID vaccines. Think about the pain points or unmet needs, emotions, and actions before, during, and after her experience. So we're going to walk through the journey map here quickly so I can show you what we're talking about. Let me share my screen with you all. Okay, let's close this page here. All right, this is the same journey map that you all saw on the screen earlier, but this is about Elaine's journey to get the COVID vaccine. We're going to talk a little bit about pain points, actions, and emotions that she might be experiencing, either getting the vaccine for herself or for her clients and helping get them through the system. So before getting the vaccine, during the vaccine, and even after the vaccine. Emily is going to be writing notes for us. She'll be putting the sticky notes on here. You all are happy to have you write in the chat any of your feedback, and we can put them on the sticky notes for you, or come off mute and we'll have a discussion here. We have about 12 or so more minutes to have this discussion, and then we're going to go into a discussion that we can talk and reflect back with the big group on. I will report back to the big group for all of you on what we discussed. So no worries, you don't have to do that. I will be our go-to liaison for this experience. So we're going to start with, based on the person's story, what might this person's actions be before? What might this person's emotions be before getting the vaccine? And what might this person's pain points or unmet needs might be before getting the vaccine? And feel free to come off mute or add your notes to the chat. If it's easier to raise your hand too, feel free to do that and I can call on you. But happy to have you just go off on mute. Overwhelmed, difficulty getting to a vaccination site. Yes, Linda, that is very helpful as we think about everyone being able to get access before a 5 p.m. shift is over, right? How do you get a vaccine if only clinics are open the office hours? Jennifer, I see trying to seek information from multiple places. I think that is so helpful. When we think about Health First Colorado, when we think about private insurance, everything's changed now since the vaccines have changed. Everyone was able to get it for free, and now there's all these new different routes that have to go. So thanks, Jennifer, for that. That's a very helpful pain point and action as well. Copy the paste the story to remember the details. Yes, I should be able to do that for you. I might just be able to pull it up here. Here we go. Hold on. And here it is for everyone. Sorry, it's going to be very long, so you can see that there. Okay, here, what else? Yeah, frustrated. Yeah, emotions, frustrated. I'd be very frustrated too, being able to navigate the system. Sarah noted navigating different brands of vaccines. Yes, that's the other piece here. It's not just different insurers. It's that what dose has someone gotten in the past? Which one might they prefer in the future? Kelly notes unreliable info, and the information has changed a lot over the course of the past 3 or 4 years. I can tell you that even in the first 6 months, every day we were getting new information that was we didn't know where to get the vaccine, or it changed and clinics change. And that's the other thing is maybe 1 week a clinic's open after 5 p.m. and then the next week it isn't. So it's really hard to know where to send your patients. Jennifer, I see frustrated, disappointed because of things of lack of availability during non-business hours. Yep. How folks learn about the vaccine availability, where and when. And that was a big, big issue a couple of years ago. And honestly, it feels like it still is now. Really, if you don't have a PCP, where are people getting their COVID vaccines? We know that 365 Health, for example, closed the other day or the other month. And so people relied on that, for example, and where do I go now that they closed? Madeline notes, potentially after getting the vaccine, she might feel like there's inconsistent information about boosters. Yes, that's really helpful for after, Madeline. That's really great. And we can jump to that too. So Emily will add that in for after the vaccine. And then Lynn notes, run around for clients and hopelessness as a feeling and as an emotion. Right? You want to be here to help your patients and help your clients navigate the system. And you're just like, I don't know where to go. It can just feel exhausting, and it can feel like you're just constantly navigating these systems around. Great. I'm going to let Emily write a couple more notes here while we keep going. Does anyone have any comments that they want to come off mute for at all? Thanks, Peter, addressing clients' adoption of misinformation. I think that's probably a pain point that we're going to feel, and an emotion we're going to feel across the whole spectrum, right? When people are feeling like maybe afterwards they're having a lot of symptoms from the COVID vaccine and they're like, do I have COVID now? All that misinformation that comes across is navigating that across the spectrum, but especially beforehand, Peter. So thanks for that. Inconsistent follow-up for outreach. Yeah, Lynn, I think it's really important. And I think this is really important as we think about any sort of vaccine that's in multiple doses, is how do we get people to come back? How do we make sure that they are fully vaccinated with regardless of whatever the vaccine is? And then just your ability as a care coordinator, as Elaine's ability as a care coordinator, to just follow up with your patients and make sure, are you getting the booster, or how are you feeling? Are there other vaccines that you might need? And the plethora of systems, Kelly, I think it's a really good point. And Kelly, I don't know if you or others want to just type in or come off mute about what we might mean by systems. Do we mean navigating the healthcare system and the reimbursement system, or do we mean getting your vaccine into CIS, which is the Colorado Immunization Information System, or is it all of the above? I mean, there are so many systems involved here, your own EMR, that are all connected. How do we make sure that that's there? So if anyone has any other ideas, specifically what you might mean by systems, I welcome that. Okay, let's go to during the vaccine, because it looks like we have a couple of empty spots there. As Elaine is getting the vaccine or helping her patients get the vaccine, what might be some actions, emotions, or pain points there? Peter notes, addressing clients' views on lack of effectiveness, averted hospitalization versus mild infection. Yes, when we think about during and after the vaccine, people are like, did this even work for me? Or maybe I got a strain of COVID that wasn't covered in the vaccine. It's so much information to take in as you're trying to think through that pain point. Lynn, language barriers. Yes, as you come in, it's going to be probably a before, during, and after issue, but especially during, making sure that those at the clinic speak the language, there's language justice involved, and are culturally, have providers who are culturally competent, who look like you, who have served those who look like you, for example. I think it's more than just language. It's going to be all of those pieces that come into play. Getting an appointment outside of work hours, yes, right, Kathleen? I think we even all probably experienced this as working professionals who are coming here to Hot Issues in Health. Like, how do I even go to the doctor? How do I leave X, Y, and Z? And it's very hard to navigate this whole world with our kids, with our families, with our work. It's a lot. Side effects, yep, during the vaccine, transportation, yeah, Kathleen, that's really, I think all the social determinants as we think about this and accessing vaccines is very important. Does the site have all the equipment, access to our records, logins? Yes. If anyone has been to an outreach clinic before or has been on the side of an outreach clinic, there's a lot that goes into it. You have to look up someone's immunization record. You have to look up like how many doses have they had? Is this a booster shot? Being able to have all the vaccines in stock, right? And being able to get consent forms signed. It's a lot going on in a kind of a chaotic process. So I think that that's definitely a pain point and something that you have to navigate during the vaccine process. Actions note from Peter: encourage vaccinated clients to convince their friends and family to get it. Yes, I think that's really important, especially, Peter, for after, as we think about the future process and really what it takes to change vaccine confidence. It's all about trust, and people trust and listen to their family, to their friends, and hopefully to their doctor. But if other people say, you know, I got the vaccine and it went okay, others are more likely to get it themselves. The emotions probably carry through all the phases. Yep. Yeah, Lynn, I think frustration, disappointment, hopelessness, etc. I agree with everything that you're saying. Side effects, contraindication understanding. Yeah, I think contraindication understanding, especially during consent, is a very important thing for everyone to understand. You might not know if you should get the vaccine, if it works for you, if it doesn't work for you, etc. Sarah notes, pain point is staffing issues in the clinics may result in canceled or limited appointments or wait times for appointments. Yes, 100%. I have been in that situation before myself, where you might have gone and then you're still waiting there an hour and a half later. We all remember the lines with the vaccines back in May 2021, for example, and how long it was taking to get a vaccine in those wait times. Is it chaotic? Line too long? Will they run out before I get my shot? Is someone crying next door? Will I pass out? Yeah, I think that those are the feelings and the emotions that someone might be experiencing as they sit there and what they might be thinking through. If you all have ever worked in an immunization clinic, like I've noted before, I have, you hear the kids crying and you're just like, no, are they okay? You know, it's just like these feelings of emotion, like the kids don't know what's happening. Teenagers are probably the worst. They know what's coming, so they cry before it comes. I'll tell you that. Kids only cry once they get the shot. Thanks, Emily, for writing all this down. Great. Okay, let's go to after. What might some other feelings be after you get the vaccine or after you're navigating the vaccine? Is there any sort of like good feelings? And that's okay if there isn't, but you know, it's not just frustration, I would hope. What other feelings or actions might you take after getting the vaccine? Relief, yep. Thanks, Kelly, for that. Worry about the side effects, yep. Even side effects themselves, right? I mean, you might have a fever, you might have the chills. These are just the things that you have to experience. And I know that we already have that in pain points. Yeah, regret because of the side effects of the experience. You're like, I really wish I would have just gone to Safeway to go get my vaccine, or I really wish I would have been able to see a PCP. Or, you know what, this is the best that I had available, but it still was a frustrating process, and I am owed a good experience. I am owed, no matter where I get my care, that feeling of relief and happiness. Worry, I have to explain to family members why I got the vaccine. Yep, Peter, I think you've kind of noted that too earlier. You know, how can we be stewards of this positive health behavior change, but also respect others and our boundaries through that process. Unknown impact of the side effects. Yeah, of work or caregiving. I think that that's probably a pain point, but also a concern as you get into that. And then exasperation with this experience, making it less likely to seek care for something else. And Peter, I think it's a really important emotion that we might feel as human beings, as people who have gone through this experience. If you have to take 3 buses to get the shot, and then you waited an hour and a half, and then you get to the clinic and no one speaks Spanish for you, and then they're only actually accepting people who only have private insurance, what are you feeling? You're feeling exhausted. You're feeling like, why am I even getting this care? And why am I even getting this vaccine? Okay. I'm going to let Emily finish writing up some notes here. Emily, you noted just like 5 more minutes or so. Okay, great. We're going to move on to the next slide on our whiteboard here. And these are the questions that we are going to report back to the larger group on. I will report back to the larger group on your behalf, so no worries there. We are going to be talking about this activity and reflecting on this activity as a whole. When you think about this type of work with a journey map, and you can use this for so many different systems, and thinking about all the systems that exist, like someone noted on here, how do I navigate all these pieces? You know, we talked about private insurance and CIS, et cetera. How did this maybe change your shift? How do you think that this shifted your thinking about how we deliver care and how we access services? And what's one action you'd like to take in response to this new way of thinking? So as you put yourself in someone else's shoes, Elaine's shoes, for example, how did this maybe change your thinking? And what's one action we might be able to take in our current roles and our current life to think about how we can change this? Because we all touch patients and clients and community members in many different ways. And we can think about these multiple systems and how they can talk to each other better. How can they work with each other better? How can we put people first and people centered? So think about this for a second and feel free to add your comments into the chat. Lynn notes, trying to maintain positive perspective when it's so easy to be negative, encouragement and proactive. I think, Lynn, those are really helpful mindsets that we should have. And that's why we started this whole thing with, let's have a flexible mindset. When we think about how we need to approach these things, we need to be able to kind of shift that way, say, okay, you know what, that's not working for this person this way. How can I actually make this better for this person and meet them where they're at, that positive perspective, that encouragement, and really, really trying to figure that out either beforehand, during, or after, and be side by side with them. So thank you, Lynn. That's very helpful. Another way to think of these questions is, how might we address Elaine's pain points to improve her experience and her potential outcomes? So how might we actually address those things that we saw in the bottom swim lane? And what might we be able to do ourselves? Jennifer, oh, thanks, Lynn, for no closed doors, ease of entry. Yeah, what's one action? I think that's really helpful as we think about the whole person care approach to this. How can we all come together to say, no matter where you're coming in, I will help you get this vaccine. There's no closed door. We'll figure this out wherever you're getting into the system here. And then Jennifer, is it a good practice to include actual clients or patients in a journey mapping exercise for an organization? Jennifer, that's a really great question. And I would say yes. As you think about quality improvement, journey mapping is one way you could do this, but you could also think of other heat maps or other journey exercises you can do to figure out those pain points. So when you think about someone going through a clinic experience, for example, you could map out from the second they walk in that door, or even beforehand, transportation, right? Accessing care through X, Y, or Z. Walk them through the whole experience. They sit down in the waiting room, they get called back, they get their record checked, they get the vaccine, they get their record, and they leave. if you have someone actually tell you, well, when I sat in the waiting room, there was an issue with this. I heard the babies crying. It was very make it stressful for me. Or it was really cold in there and I didn't feel comfortable. I was like shivering the whole time. I was already nervous to get this vaccine. Whatever those pieces are, when you hear from them directly, you're able to figure that out. So that could be through like that kind of mapping approach, but this journey approach could be another way to learn directly from them if that works for you better in this journey map. So yeah, Jennifer, I think it's a great idea. And it also helps you just put yourself in their shoes. But if you hear from people directly, that's even better. What other actions might you take for this way of thinking, or how have things changed for you as you think about using a tool like this? As a navigator, surrounding Elaine with consistent communication, assistance with social supports and wraparounds to address the circumstances of the pandemic so she can best assist clients. I think it's really, really helpful. Thanks, Lynn. I'm going to pause this because I'm not sure if the room is chatting or not. I think they might be trying to get to us. They see them on the microphone. I'm going to mute myself and then unmute them and see if we can hear them, if that sounds okay, everyone. Okay, I think they are chatting on the big room. I'm going to check in with them and we'll try to get back so we can hear report outs from everyone. And thank you all for your feedback and for your thoughtful discussion. I'll report out back for us, but keep adding your thoughts to the chat here. I really appreciate your active participation here and learning something new with me today. So thanks.
Will you do me a favor, Ashley? Is that mic on? There's a button to turn it on.
Is it on now?
Yes.
Yeah, just give it up.
Okay, great. So I'm getting a thumbs up. Our virtual audience is back with us. Thank you all for your patience. I'm going to bring us forward to this final reflection question. As a result of this new way of thinking, what's one action that you would like to take moving forward? As a result of this new way of thinking, what's one action that you would like to take moving forward? Okay, I see some hands in the room. Let's start here and then I'll go to the virtual audience. Go ahead, Nina.
I've got two back here.
Oh, great.
Yes, we're going to kind of combine ours, I think. One of the things that we talked about was taking this activity to stakeholders so they're involved right from the beginning and they are able to provide their unique and lived experiences. And I think I'll hand it over to you for the second half.
So I run the Healthy Community Collaborative in El Paso County, and it's a stakeholder meeting that involves community partners, over 60 of them. And we collaborate to develop our community health assessment, community health improvement plan. And I think this is a great way to kind of put a visualization of everyone's thoughts rather than just like throwing out and discussing, which people can get lost in that. So I think this would be a good implementation. This process would be a good implementation. And it's very like Lean, Six Sigma, QI related. So I think that helps as well.
Well, thank you for that. Now, I also invite those that are interested in taking this into their community. Kirsty and I would love to talk with you outside of this room so we can absolutely make that happen. All right.
Hi, I have the last one. I have to earn the raffle tickets. We maybe half because of me, got hung up on making assumptions for somebody else that we didn't have any lived experience. Ours was Victor, provider, but we had a provider at the table. And once we started asking her questions from that perspective, questions started coming and it was more easy for us. So I think one action is to do what we can to have somebody with that experience at the table to help facilitate that. Thanks.
Thank you so much for sharing. And that was a good summary of our discussion.
All right. Okay, we're going to go ahead and keep moving forward. Thank you all for kind of walking through that journey with us. We believe that we've all kind of taken one step forward today, right? And learning a new way of working together, whether you're already familiar with journey mapping or not, right? Now you have the shared experience with others in the room. We now want to transition into a speaking or hearing from a special guest whose name is Stephanie Puglisi. She is the director of the Colorado Office of eHealth Innovation, and she is going to share with us how her office has already started to use journey mapping in the real world. You probably already picked up on that we've had a few AV issues, so I'm going to have to leave you for about 20 seconds to get Stephanie up on the screen. So thank you again for your patience. Stephanie is going to be joining us in just a second.
Kirsty, do we have time for any comments from our online participants?
Yeah, let's break for one.
Okay.
Hi, everyone. Can you hear me okay? It doesn't seem like the room might be
Hey,
able
Nicole,
to
can you hear us?
Yes, we can hear you.
Okay. Yep.
Can you hear us okay? It doesn't seem like you can hear us.
Recording in progress.
Stephanie, can you hear us?
I can. Can you hear me?
Stephanie? Great. Okay. All right. So I'm going to go ahead and turn off my mic, Stephanie, and then turn on my computer volume, and this should work. Stephanie, go ahead and get started.
Ooh, this is fun. Can everybody hear me okay? Okay, great. Thanks, Valerie. All right. Well, hi, everyone. AV issues abound in 2023 and beyond, I'm sure. So thank you so much for having me, even virtually. I apologize I'm not there in person, as probably many of you have already been through. 'Tis the season for viruses, so wanting to keep everybody safe. So I'm really pleased to be here with you today, and I hope you've had a wonderful day learning about all of the hot issues in health. For those of you not yet familiar with our office, I'll provide an overview of the Office of eHealth Innovation, fondly known as OHI, like, oh, hi, and the eHealth Commission, as well as our priorities. So this includes the Colorado Health IT Roadmap, our latest efforts to move that work forward, and how we support Governor Polis and Lieutenant Governor Primavera's vision of a Colorado for all. And so in this, I'll really focus on how we approach our work to make sure it's meaningful and useful for all Coloradans. I don't know where the slides went, but I'm ready.
Sorry, Stephanie. I was just told to stop sharing. So
oh, okay.
If you need me, if you all need me to go back, please let me know and I'll share the slides. Sorry, Stephanie.
But that's okay. It looks like Kirsty's on it. Should I keep going, Kirsty?
Kirsty, we see your presentation mode. Yeah.
You can keep going, Stephanie.
Okay. So for background, OHI and the governor-appointed eHealth Commission were established in 2015 through an executive order. So this was a result of broad stakeholder input and a request for action to create a neutral entity to establish strategy and coordinate policy and funding for health information technology in Colorado. We've been busy in the past 8 years, and we are located within the Office of the Lieutenant Governor, and our fiscal agent is our state Medicaid agency. Many of you know them as HICPUF. Our vision is to advance health equity and reduce health disparities through coordinated health IT policies, funding, and technology itself in Colorado. And once we are back on the slides, ready for slide 3. Perfect. Oh, that was it. Nailed it. Thank you. So we refreshed Colorado's health IT roadmap in 2021 as the state strategy to guide this work, and actually partnered really closely with CHI. We developed this by our office as well as the eHealth Commission with input from many partners and stakeholders across the state, including likely many of you. And by doing this, we really simplified the strategy to ensure the focus is on the people we serve and the problems we're solving and less on the technology. So that's where this ties really nicely into that journey mapping exercise and session. So this means that the roadmap puts Coloradans and their health first. Its goals and recommendations support Coloradans accessing needed care that they can afford, and all Coloradans having equitable opportunities and resources to be healthy. The 2021 roadmap goals support access, affordability, and equity, as I just covered. And you can see those full goals written on this slide, and you can find the full roadmap on our website. Next slide, please. So the roadmap's goals are about creating the technical backend infrastructure to ensure connections are in place between all partners who may need to share or have access to data and information to better support individuals, and who are permitted to do so both within existing regulations and individual permissions. In 2023, we have the technical capabilities for this to happen, and we need to coordinate our efforts, funding, and brainpower to develop and support a system that works for all Coloradans. This graphic can be seen in 2 ways. One, that all of these entities are focused on the patient and create a supportive ecosystem so that individual can thrive. Or you can look at it that the patient must work individually with each of these providers and is responsible for repeating their information 8 or more times. So just take a minute and reflect on which scenario you think we currently have in our system. You may interact with just a few or all of the individuals listed on the slide, and this is not comprehensive. Obviously, there are many more aspects to our health ecosystem. So you may be interacting with these folks for your own healthcare or that of someone you love, or both. Even for those of us who are lucky enough to remain relatively healthy and have strong support networks, navigating healthcare in our current system is overwhelming, frustrating, and time-intensive, probably similar to the journey mapping that you all just went through. So currently, most systems are separate and require manual data sharing by the patient or caregiver, if sharing is even permitted. For all of us, as we're all patients, this means the burden of recounting our medical history remains on us. That alone can be difficult, recalling not only your immediate history, but the dates and details of past procedures, various medications, and encounters with other types of providers, much less if you're there on behalf of a loved one and remembering all of that information. This also takes a valuable time during our appointments with our providers. Instead, that time should be spent on our current state and needs. Next slide, please. On the other side of the experience are our providers, who face higher patient volumes and expectations than ever. They need information that is quickly and easily accessible to better coordinate and improve care quality or participate in value-based payment models. They too would prefer to spend time with their patients focused on their current issues and needs, rather than sifting through data in various systems and formats. Again, this isn't totally inclusive of everything that they deal with. They deserve technology that supports their expertise in decision-making rather than challenges it. Taking time to jump between all of these systems listed on the screen decreases the quality time spent with patients, burdens support staff and resources, and can even result in additional opportunities for mistakes. Next slide, please. While many incredible support programs exist for patients, including those focused on coordinating these programs, the burden of managing these services, appointments, and other needs remains largely on the patient. Again, in 2023, we have the technology to enable a better experience, but the data to truly develop a person-centric system continues to be siloed. This results in the ecosystem displayed on this slide: complex, repetitive, and overly burdensome to patients and their families already navigating what could be one of the most challenging chapters of their lives. For individuals with complex needs, especially those who participate in public programs, the workflow feels chaotic and disjointed. Case managers and providers do not have the information they need in their preferred system of record to make informed, holistic decisions about their clients' health, including their social health. This creates a dual challenge, where some people are screened repetitively for their social needs, where others are never screened. Even those who are screened frequently may not have their needs met, as referrals issued on their behalf may never make it to a recipient. Additionally, the providers making the referrals are left wondering whether the client completed the referral. This system not only disempowers patients, but providers as well. Without access to all relevant patient information, providers must rely on patient memory and any information the patient physically brings to their appointment. As I discussed on the earlier slide, providers already have many separate systems to navigate. This also requires focus and takes concentration away from the patient in front of them as they navigate between technology systems as if navigating a treasure hunt. This is not only frustrating, but it increases the cost of care by requiring time of providers and support staff to navigate unnecessary administrative tasks and invest funds in multiple separate solutions. Instead of continuing to allow yesterday's technology and self-imposed data silos to continue to set the pace of health technology and innovation, let's challenge ourselves to do better. Here in Colorado, we pride ourselves on our spirit, resilience, and creativity. Our team aims to channel these qualities into the heart of our work, which is exactly what led to our latest initiative. Next slide, please. So OHI is leading a key initiative to change this ecosystem in Colorado, broadly termed the Social Health Information Exchange, or SHE. This will be a vendor-agnostic ecosystem, enabling data from state, community, and health systems to interoperate in support of coordinated whole-person care across the physical, social, and behavioral health domains. For all of us as patients, this means our data will be shared to the right people at the right time as laws and regulations allow, and that we will be empowered to grant and revoke consent to share this data. For our healthcare providers, this means they can remain in their chosen technology solutions and also spend less time searching for relevant patient information. This is a monumental effort which focuses not only on technology architecture, but data governance, federal and state policy, and legal requirements. We're just beginning the work for this system and are thrilled to work with all of you toward a true Colorado for all. This is an intensive, ongoing, multi-year development effort. We're very intentionally building the initial foundation for this architecture to support Medicaid beneficiaries and connect to our Colorado Medicaid system. The long-term vision is to include all payers and sustainably fund this system through cost allocation. Ultimately, the SHE will also allow doctors to connect patients to wellness, health improvement, and preventive health programs, such as diabetes management and prenatal programs. We recognize there are many innovative efforts to address this already underway throughout the state, which is why we're focused on a two-pronged approach here: supporting and elevating local community efforts, as well as developing a statewide unifying architecture. So our work right now is focused on that unifying architecture, and early in 2024, we'll have opportunities for communities to apply for grants to connect into that architecture using the systems they already have. So in this way, we aim to leverage current systems and processes, as well as the lessons already learned from their development and implementation. Next slide, please. So now gets to the good stuff. As we embark on the development of the SHE, we worked with partners to develop a variety of client personas and stories. This is key to developing a system that truly works for all Coloradans. And I'll walk quickly through them with you today. So here you can see Vanessa. I won't read this slide to you, but some highlights are that she lives with a roommate in Fort Collins. She is struggling to pay her bills and therefore buy healthy food. She also is not super interested in learning or trusting technology. And so we want to make sure that we are cognizant of that and not forcing her through a system that she doesn't trust or feel empowered by. And so I know we're a little bit short on time, and this is a really heavily worded slide, but you can see thinking through, the basics of Vanessa's background and situation, as well as what her goals and needs are. So from health needs to personal preference, as well as challenges and frustrations. And then thinking through again, if she is not super interested or comfortable with technology, then we need to make sure that we are building something that she doesn't have to necessarily directly interact with by herself, or that will work easily for her. Next slide, please. And on the other side, since this infrastructure is intended to support care coordinators and providers as well, and truly drive that systems level change, we also developed a user persona and story for the coordinator side. So we'll walk through Caroline's story here. Hers, as you can see, is a little bit less in depth. We don't need to know her personal background necessarily, since this is just focused on her work. So we have her goals and needs as a care coordinator, as well as her frustrations and challenges as a coordinator as well. And you can see, hers are pretty technical or technology focused, but also include just how she spends her time. So that last bullet in the challenges and frustration says that it's intensive to find resources if she doesn't already know about them. And then again, thinking through how can the she support Caroline as well. And rather than saying, here's a very specific technical requirement, here's what we want the system to be able to do for Caroline. Next slide, please. And then last but certainly not least, we put their journeys together. So in walking through Vanessa and Caroline's journeys, we really developed the requirements, part of the requirements for the she. We identified their shared struggles and where technology can intervene. And you can see at the bottom of this graphic that system level impact. So again, we don't expect that this is going to be a magic wand or fix, all of the various gaps and pitfalls in our system today, but really walking through what is the, patient or individual's needs, what are the care coordinators' needs, where do they overlap, and then where can we use technology to build that net is really exciting. So, we hope to make true incremental and lasting progress here. And again, it's not going to be a magic wand, and it won't be immediately perfect. Certainly, we'll be starting with the foundation and then building out from there. And then I think I have one more slide, please. Yeah, so we would love to stay in touch. Again, this is going to be truly a statewide effort, and we're really excited to work with all of you to make sure that we are developing a system that works for everyone. So please don't hesitate to reach out. I'm sure you can get my contact information from any of the CHI group if needed, or feel free to follow us on any of those platforms. Thank you so much for your time.
Little bit of insight.
Hey everyone. Can you guys hear the room right now?
No, we can't, Biani.
Okay. Sorry about that. We're just going to end the session. Everything is pretty much over now. Oh, 1 second.
The third takeaway, again, journey mapping may not have been a new tool to all of you, but to some it was. And that is sort of the gift, right, of using tools. We can help each other use them along the way. Journey mapping is one new, more innovative tool available to us to help create more people first systems, right, all in the spirit of working toward health equity in our communities and across the state. So thank you again so much for bearing with us today. We hope you enjoy trying this out. We will stick around if you have any questions and want to learn more. Thank you all so much for joining us today. This conversation, this activity, it is a journey, and taking the first step is always what we must do together. So thank you all, and we look forward to continuing the conversation.